Hello, and welcome to Community Voices, where we talk to Humboldt County's movers and shakers. Today's guest, Veronica Yank, MD, Director of the Rural Dementia Caregiver Project. And now here's your host, Paul Bersu.
Hello, and welcome to Access Humboldt's Community Voices. I'm the host, Paul Bersu, and today we're speaking with Veronica Yank, the Director of the Rural Dementia Caregiver Program. And Veronica, I always start the interviews by asking people, what is their job title and what do they do? So I'd like to ask you that very question to get started.
Yeah, thanks, Paul. So I am an associate professor of medicine at UC San Francisco. In my role there, I am a primary care doctor for adults, so a general internist on the clinician side. At the same time, I do a lot of work, both research and community projects with partners around the Bay Area, but the broader California as well as nationally. And the Rural Dementia Caregiver Project is one of those research and community embedded projects.
So now you're in San Francisco right now as we speak. And is this a project that you run? Is this a project that you developed? Or is this a project that somebody assigned you to and thought you'd be perfect to be in charge of such a program?
Great question. So this project is a brainchild of myself and other partners, both other researchers at UC San Francisco, Stanford, Texas A&M, and then rural serving organizations in different areas around the country, including 2 in the Humboldt area. So we developed the idea for this project, which is focused on testing a 6-week online training, skills building, and support program for family and friend caregivers of loved ones living with dementia and memory loss in rural communities around the country. And we essentially pitched it, but as a research and implementation project to the National Institutes on Health, and obtained 5 years of funding for this ongoing project. The project itself provides this 6-week workshop for small groups of caregivers, and then for free. And then we study how it is for them. We pay folks to complete the study survey part of the project to tell us what they liked, they didn't like, what they'd want to see changed for, workshop 2.0. So that in brief is the broad scope of the project and how it developed. And there are a lot of people. I'm sort of the figurehead for your show, but let me just say there are a ton of people doing great work to get this out to our rural dementia caregivers.
Okay, so now I'm going to go back again. Is this your specialty in medicine, the dementia care? And then if so, obviously it would seem that you felt that rural communities were underserved. How did you begin to reach out and develop a program to help train the caregivers?
Thank you for that question. It's a wonderful one. So part of it was way back when I was a baby doctor, a number of years ago. I began to notice as a adult primary care doctor, we're the specialists in helping people manage their conditions over time. For the chronic conditions, obviously we do other things as well. But I, in particular, developed interest in helping patients and their families manage tough to manage chronic conditions. And I certainly noticed in my clinic when a family member or friend developed cognitive impairment or then progressed to dementia, obviously that's an extremely tough condition for the person with it, their families, their communities to manage. And I certainly also observed with it when that person had somebody available to support them, often things went better. So, a daughter or a spouse coming to the visits with them. At the same time, sometimes the daughter or spouse of the person with dementia was also my patient. And when I would see them, I would realize just how stressed out they were, that their own health was certainly suffering, and that, I, in a lot of ways, felt at a loss for getting them the help they really needed. And so that was my first insight into the needs. I then was involved in leading a project actually for the Veterans Health Administration, more usually known as the VA, which focused on a workshop, a version of the workshop we're testing for rural caregivers. And what I noticed in that, they'd implemented it in VAs across the country for caregivers of veterans with any chronic condition. What I noticed in my evaluation was that the rural caregivers who were able to access it were some of the ones who were most thankful. And when they interviewed them, it was because they had, on average, much less access to support services and much higher need. And certainly among them, sometimes the folks caring for loved ones with dementia were also some of the folks who were most stressed out. So I said, I want to bring this to the people who need it most. And that was kind of the idea then behind the Rural Dementia Caregiver Project, is that rural communities need more support. And I want to, I'm hoping this project is doing its own small bit to address some of that need.
When a patient develops early dementia, is it most likely that a family member or a caregiver that they know is going to be looking after them, at least until they could get more advanced help?
On average, yes. Certainly not the case for everybody, but yeah, unfortunately, there's a whole subgroup of folks living with early dementia or even mid dementia who really have kind of no one in their neighborhood, so to speak, helping them out as a family member or friend. And so we need to develop, a much more robust support system for those folks as well. But on average, folks living with dementia have somebody who might be helping them or trying to help them. It's widely variable though. And some people have more than one, they have people fulfilling different roles who are family members or friends. There's, of course, for some folks, the option of paid support. The issue there is, again, in rural areas of our country, even those types of support are fewer and further between. There's just more demand than trained and available, paid caregivers for in-home services or other things. And then, of course, eventually it may be that the person living with dementia gets transitioned to, out of their own home, their own community, potentially to assisted care, and then potentially nursing home level care as the need may arise. My goal is to keep people in, if they want to stay in their community, their home communities, as long as possible. Obviously, I want to help my patients do that. With dementia and dementia caregiving, sometimes that's just no longer possible. So the workshop also educates caregivers on kind of planning for the future and what that might look like if it really is an untenable situation for their person to stay in the home.
What two areas in Humboldt County did you specifically target for this program?
Well, we're targeting every area of Humboldt County. So honestly, I'll give you, in a second, or whenever you want me to, I will give you information on how people can learn more about the project. It is open. We're very permissive in how people are eligible for the project. So They have a couple questions they answer. One of them is that they're 18 years or older, so they have to be adult. They are asked the question, do you live in a rural, small town or farming community? If they say yes, they've met that criterion. And then just a couple other questions. So we've really tried to streamline the process, but it does mean that because Humboldt County, is overwhelmingly rural or small town, a lot of the folks I imagine would be eligible are on the ground partners in the area, are the Humboldt Independent Practice Association, which is a health system. And then United Indian Health Service of Potawatomi Village, which serves a number of the tribes and rancherias in the Humboldt and adjacent counties. So that said, you don't have to enroll through them. You can enroll with our toll-free number or go to our online website and just do it all remote with our project staff.
Before we give out that contact information, my question is, what is the caregiver applying for?
Yeah, it's to get involved in the workshop and the overall project. And the reason is it is funded. It's a research project funded by the National Institutes for Health. We need to demonstrate its impact for rural caregivers. Based on prior work, we think that's going to be a no-brainer. But we have to, publish it in a scientific journal, and then the next step is that the government is more able to pay for it for local communities. So when they sign up, they get assigned to a workshop. It's not, we try and assign them either to workshop or support phone calls, and I can explain that in a second, but primarily to the workshop for the next available workshop. Each workshop involves about 25 participants, other caregivers, along with whoever might be enrolling. And so, we launch a workshop once we have 25 caregivers, and then we have 2 trained peer facilitators who help the caregivers with the lessons, provide support, and just kind of monitor how things are going for the 6 weeks. But those facilitators have been caregivers themselves, either currently or prior have been caregivers themselves. So they're basically signing up for a workshop. A subset get support phone calls before they get the workshop, but anyone who enrolls is offered a workshop.
And then, okay, so tell us how they can sign up and how they can contact you. And then after you do that, I'd like you to tell us how you got the word out about this.
Absolutely. Okay, so to your first question, how to get more information and sign up, we have a pretty robust website for those who like to explore online. And the URL is Caregiver Project, all one word, so just Caregiver Project .ucsf.edu. So Caregiver Project, one word, .ucsf.edu. We also have a toll-free number that really goes to a real person, Elizabeth. So she is one of our staff on the project, and that toll-free number is 833-634-0603. So once again, 833-634-0603. If you leave her, if she doesn't pick her up right away, leave her, Elizabeth, a voicemail message and she will call you back.
Okay.
And then, question number 2 was, how do we get the word out? Well, in lots of different ways. Some of our, on the ground community partners, like those I mentioned in the Humboldt area, have done what they can to help us. We did launch during COVID, and a lot of our partners were, for obvious reasons, having to put all their resources into managing the community needs more around COVID. So then my staff got pretty good at reaching out to, various media, whether local newspapers, radio, TV, such as your work. We also have tried to spread the word through social media, through more classic, area agency on aging, community embedded groups, health systems groups. So a lot of it, Meals on Wheels, anything that we thought might work to spread the word to rural communities.
So it seems like two things are going on here at once. You're collecting the information that goes into the study of the project, and you're training people to be more efficient caregivers to the folks that they are caring for. What is the information that you're collecting?
Oh, on the study side?
Yes.
Yeah, so we just ask questions. So we ask questions, and by the way, all the data collected, ends up, the identities are protected, anonymous data collection. We're very careful about data safety, as you can imagine, for any study, let alone that I'm a doctor and know all about protecting information. But in any case, we collect information on some basic demographics, and then their mood, because some of the things that we have been told by caregivers on other projects of mine, are just how high their stress level is, or perhaps they're depressed or feeling guilty or angry, isolated. So we sort of collect data before the workshop on how their health is, their health and well-being, and then at various points right after the workshop's over, and then even a number of months out, just on those same measures, just to see if things have changed. And then we also collect information at the same time on what they've liked or not liked, let's say, about their experience in the project and workshop, who they think would be benefit most from it, because they're the experts. The caregivers are the experts on themselves and the folks like them. And then we finally even collect their recommendations on how to spread the word even more, so we can get the word out. So all of those kind of domains, their own health and well-being, what they liked that we should keep, if there are things they didn't like that we should, modify, and then finally, how can we get the word out?
Well, so you're talking about studying the data for care for the caregiver, so to speak, that you're trying to make that job easier. And then do you also study a translation of how the patient is doing, given the fact that now they're having a caregiver that has more support, more expertise?
It's another great question. So we do that. We do that a bit. It's not as robust as the information we collect on the caregiver's own well-being, in part because, anyway, there are lots of ways that I don't need to go into, but for the scope of the project and the fact that we're delivering it remotely, we didn't want there to be a ton of burden on the caregivers who are already burdened. So we're not asking them a ton of questions about their care partner, their person they're helping to support, but we do ask them using these validated measures that have been shown to be fine for a second person report. They report on levels of function, of their person, changes in cognition, other health issues, just an overall well-being measure. In the measures, so these questions are going to the caregiver, and they answer on behalf of their person. Scientifically, they've been shown to correlate with chart records, let's say, from the doctor's office or other things, and that's why we think it's fine, scientifically sound to use those. So yes, we are also following some aspects of how the person with dementia is doing.
Now, I looked on your website and I read the testimonials, and a question I'd like to ask, do you find yourself building a community of caregivers? Do they have a way of connecting with each other? Is there a support amongst these people who are isolated, being rural, is there a support group, a community that they're building?
Oh, it's such a wonderful question. And it's actually so important, and it's a mainstay of the workshop itself. So in addition to, and it's part of the reason we have it as a small group thing. So the situation is they have their own private learning center where new lessons roll out each week on, their own self-care practices or caregiving skills. But then just as importantly, they have these shared discussion boards that they can log into at different time, but basically they have ongoing conversations with each other across time. So one way to think about it is maybe a little bit like Facebook, in that, Veronica, I can post a question and say, I'm having a lot of trouble with bathing time. My person is really resistant. I don't know what to do. I'm also worried about safety in the shower. And then Paul, you're also in the workshop, but you're on East Coast time and I'm on West Coast time. You log on a little later and read my post and you say, oh, you comment, oh yeah, oh my gosh, this is such a problem. I agree. Here are things I've tried that have worked or not worked. So there's a whole dialogue and support going on so that people do feel less isolated and do have a network of essentially peers going through the same journey. So we have heard already, we've done a bunch of interviews even with people who finished the workshop, and that's an aspect that they really like also. Not everybody, some people want to read all the conversation, and they enjoy doing that, and they don't necessarily want to write or engage. But for a lot of people, that social support aspect is just as important as the other skills building components of the workshop. So that is a part of it.
Has that been an unexpected, I would say, benefit for sure, part of the study and the workshop?
Well, yes and no. I would say we specifically designed it knowing that caregivers felt isolated and wanted to connect with other caregivers. The surprising part is probably just how engaged they are with that, to the point where, and I love your question, it really strikes at the heart of where we think the workshop 2.0 could go. Right now, there's no community, once they're done with the 6-week workshop, unless they somehow share their personal information with other attendees, there's no way for them to stay in the caregiver community they've built. It just wasn't built into the program as it stands or into the budget. But it points to a need that we think, having an alumni, it's something the VA does have for their version of the workshop, and we just didn't have the money to build it in. But the fact that people really want to stick with these networks that they've built and find so much value in them, that was surprising, and they're asking for it. And so the next iteration, we want to try and figure out how to provide that even after the 6-week workshop is over.
When you started the program, you talked about researchers that you were working with all the way to Texas. And then when we were talking about the chat rooms, you talked about being on East Coast time. How widespread is this study? Are you coast to coast with this? How many people?
Yeah, we are. Yeah. So
how many people have had the training?
So far we've had over 320 at this point, and from 42 states. The biggest representation is from California and from the Northern California region, kind of Humboldt and adjacent counties. That said, we, Florida, Maine, Minnesota, Idaho, we got folks from all over. And I think it's a testament to just how much they're searching for something. And if you're in a really small community, you really might not have somebody going through this journey the same time, the dementia caregiving journey, the same time you're going through it. And so that we've asked people in the interviews, like, how has that felt for you, having people, from not your immediate area. And they've said, oh, it's great. They're still going through this, similar thing. So I'm okay with that. Yeah, we were kind of wondering about that. But given that it's online and we can pull people from all over, we opted to do it that way. And it seems to be going great.
So obviously, if rural care is difficult to get for those people with dementia, it must be difficult to get for those people with anything. And if that's the case, there's all kinds of care being given in rural communities. Do you find folks that are dealing with different medical issues, are they looking at what you're doing, building this system? Are there other groups, let's say, that have medical interests that are interested in empowering rural people?
Yeah, absolutely. There are, and that's part of my excitement and the joy I'm getting actually from working with the community-based organizational partners that we have in these different areas and states around the country. Typically, they are area agencies on aging or other, some health systems, some other groups, but focused on services for older adults. When the older you get, the more often health conditions you collect. So it's not surprising that they are very interested in figuring out how to help their communities get other services. And people, even people living with dementia, they commonly have the other health conditions too. Whether it's some form of heart disease or diabetes or lung disease, and so the caregivers, even in our workshop, it's not just that they're managing their person's dementia, they're often also trying to support and manage a number of other health conditions, let alone their own. So yes, the answer is both researchers and policymakers and service providers are scurrying and advocating for more supports to rural people. So hope to continue to push the needle in the right direction on that.
That's about all the time we have for today. That went fast. You're a great guest. I'd like to thank my guest, Veronica Yank, for being on the show. And we'll see you next time on Community Voices.
Thanks for joining us on Community Voices. If you represent a nonprofit that is interested in being a guest on Community Voices, email info@accesshumboldt.net. Access Humboldt, local voices through community media.